Revenue cycle management is the process used by healthcare systems in the United States and all over the world to track the revenue from patients, from their initial appointment or encounter with the healthcare system to their final payment of balance. It is a normal part of health administration. The revenue cycle can be defined as all administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue. It is a cycle that describes and explains the life cycle of a patient through a typical healthcare encounter from admission to final payment or adjustment off of accounts receivables. From all the preparation that precedes a patient's visit to your practice, the claim or the invoice, bill submitted to a health insurance company, and interactions between provider and payer after a claim is submitted is all part of a normal revenue cycle. But that doesn't mean you're actually making the revenue you desire or deserve. Number 1, prepare for care. When you prepare for a patient visit, you are essentially preparing to get paid. Though there are many viable ways to operate a practice, you should consider the following directives. Check eligibility. Even if a patient has been to your practice before, it's important to check insurance eligibility. Patient coverage can turn on a dime, but when you check eligibility, your practice can prepare for changes before a claim is created and avoid inevitable denials. Obtain prior authorization when needed. Some patients need prior consent from their insurance provider before your practice should provide services to them. This step is only mandatory if you wish to avoid denials. Number 2, turn doctor's orders into code. After a patient visits a practice, they probably don't know where all their signed forms or doctor's notes end up, but medical coders and billers do. A medical coder reviews clinical documentation to translate billable information into medical codes using CPT, ICD-10-CM, and HCPCS Level 2 classification systems. In short, they translate medical reports into codes used in the healthcare industry. Number 3, billing. A medical biller translates coders' work into medical billing claims that include all relevant medical codes and charges for a patient visit. They'll also submit and follow up on claims to ensure the practice is properly reimbursed. Upon finishing billing claims, medical billers will send a billing claim to a clearinghouse to get scrubbed for any missing or incorrect information before being sent to the payer. This middleman is important and a virtual necessity. The toughest part of all of this work, however, is that at some point you'll see a denial because of an error that was completely avoidable. Number 4, insurance adjudicates the claim. Once a claim is passed to an insurance provider, it will go through what is called the adjudication process, a process by which insurance providers judge whether claims should be paid in full, in part, or not at all. Number 5, claim paid, where payment posting team participate in RCM to the viewing of the payments and the financial picture of medical practice. It also refers to the logging of payments into the medical billing software. It provides a view on insurance payments and EOBs, payments from patients, and insurance checks from ERAS. Number 6, claim denied. A claim denial applies to a claim that has been processed and found to be unpayable. This may be due to terms of the patient-payer contract or for other reasons that emerge during processing. Reworking denials can be expensive and time-consuming, but you're leaving thousands of dollars on the table if you don't get your claims paid. In fact, the AMA found that denied, rejected, resubmitted, and underpaid claims can cost your practice as much as $100,000 per month. Denied claims actually spend longer in accounts receivable, cost money and time to rework, damage cash flow, and often result in lost reimbursement and increased write-offs. But you don't have to settle for denials and underpaid claims and lose hundreds of thousands of dollars every year. The good news is that there's a modern solution waiting for you to try. Eminent Health is a modern revenue cycle management company that integrates with your needs to allow you to see the big picture of what's going on in your practice with payer contracts, denials, and underpayments. We can also check eligibility and provide accurate upfront patient cost estimates before services are rendered. Eminent Health team will also help you to input your claims with 100% accuracy. And as per the CMS rules, data to enable you to increase revenue and decrease AR day.